Well, switching topics, you know what to do when kids come down with a fever or with the flu, but you may be stumped by the patch of itchy skin that your son won't stop scratching at or the wart that you spotted on your daughter's hand. Dermatologist David Myers is here with solutions to your kids' skin problems. Always good to see you.
Thank you.
Let's jump right in with a problem I know is troubling a lot of families, especially in the winter time. That's eczema.
Yeah.
What should we be treating that eczema with?
So, I mean, something strong, ointments, moisture, creams, lotions. It depends how bad the eczema is.
Sure.
So every time my kids roll out of the bath, you know, they want to spread for the hills, but I always try to put something on to trap that moisture in.
At night, if they're complaining of that itchy skin in bed, any solutions there?
Yeah, I always wondered, why does he think about it when he's in bed? He's thinking of my kids because all my kids have eczema.
Right.
I think it's because he's teasing his sister and brother during the day, and then when they're sitting there laying, they're like, oh my gosh, what the heck, and they start itching.
They're thinking about it.
So, I mean, Vaseline is a great, I've kind of given up on keeping his sheets clean because I love something thick. I think it kind of moisturizes it. You want to restore the barrier in eczema.
So Vaseline for the nighttime. What if the lotions and the ointments burn the skin? What do you do in that case?
So lotions are great. People love lotions because there's alcohol and then they evaporate. They don't get on your blouse or whatever. And that's why people don't really like, you know, ointment or sticky stuff, at least, you know, for a day-to-day thing. So if I'm putting lotion on my kids and their skin is open or raw, it's gonna burn. There's alcohol in there. So putting a little bit of, if that ever happens, they say it's stinging, Dad, you know, or I recommend to my patients, put on something thicker, like a cream or an ointment.
And when do you know if you should see the doctor and really get that professional help?
Well, trying some of these over-the-counter products, and again, I just kind of brought a smorgasbord of different stuff because there's a lot of great stuff. You know, there's things that have eczema on them, things that are a little bit thicker, especially here in Utah where we are dry as can be. But when to go see a doctor would be if these things aren't working and you need a little bit of extra help. Specifically, the one thing about eczema that can help, besides just a Vaseline or a barrier protection, is to decrease inflammation. When the skin gets kind of opened because of dry skin and you lose your barrier, pollens, pet dander, stuff can get in, and that's why people break out in the crooks of their elbows or behind their knees or around their eyes in the spring or whatever. And so if you're getting kind of a lot of inflammation and these things aren't sufficient, then come on in and I add a little bit of a cortisone with a healing cream. And that helps out a lot. Let's talk about an equally attractive topic, warts. How should we treat warts? Well, warts are hard to treat.
Yes.
That's why 90% of the population are going to get warts, and that's why they're the bane of like every high schooler and you know, preteen.
Does the duct tape trick really work?
I don't know. It looks kind of cool. You got this. You got this sweet designer duct tape. So does duct tape work? Yeah, somewhat. So nothing's perfect. Warts are a virus. A lot of kids get them, and they kind of hide from the immune system out on the top of the skin. So what we want to do is irritate the wart to get the body to come in, recognize that it's a wart, and get rid of it. So what do? I mean, we do anything to kind of blow it up and get the body to kind of go to that area and clean it. So by you guys doing, or by patients doing compound W or salicylic acid at home and thinning it, duct tape irritates it, kind of keeps it moist and sticky. But when people come in, I mean, I can, you know, freeze them.
Pull out the big gun.
Yeah, the big guns, and you know, little kids won't like that, so I use this stuff called beetle juice, which is, no joke, a blistering compound from a beetle in the Amazons.
Oh, wow.
It works good.
All right. Well, if people have individualized skin questions, where can they get in touch with you?
We are at Utah Valley Dermatology. We're in Lehigh, and we're on the web, and they can find us.
All right, Dr. Myers, thank you so much.
Sure.
We'll be right back.